Thank you for joining us for our third speaker for the World Food Safety Day. I'd like to introduce James Teio, who is joining us from Papua New Guinea. James has a diploma in environmental health science, is working as the program officer for food safety and quarantine at the PNG National Department of Health, Environmental Health Branch. Thanks for joining us, James. And I'll handle this session a bit differently because for the live chat today, rather than a presentation, I'm going to be asking James a series of questions to get a feel for his role in food safety in PNG. And also, if you'd like to ask a question of James, then please just type a comment below the video at any time, and we'll come to those at the end. So welcome, James. How are you?
I'm all right. Thank you. Thank you very much.
All right, our first question today, James. What does an average day look like for a retail food safety inspector in PNG? Over to you.
Yes, thank you, Phil. PNG is geographical, a very difficult country at the moment. I mean, everyone knows that. Mountains, islands, on the coastals also. But really, I'll be speaking especially on the city, what happens in the cities and towns. For food safety inspectors today. So food inspectors daily they go out to the shops, maybe restaurants, tea shops, and all that, supermarkets, all that. Food safety inspectors come across many violations to the list. For example, some insect infestation, temperature violations. Maybe some leftover food sold yesterday and we sold again, reheated and maybe sold again the next day. Because we have problems with storage areas, especially in this climate. We have rain and sun, and yes, and we also many the industry or the facilities don't look after their food properly, their storage. They may have cross-contamination, and those are some of the few that I can mention. And then violations are real, and foodborne disease risks at many of our food outlets or facilities are great here in this country. And apart from, like I said, the other obstacles like geographical, maybe transportation, weather, and all that stuff.
Sure. Yeah, I imagine that you have lots of issues with refrigeration and those sorts of things. And in that, how do you support retail food establishments to improve their food safety practices?
Okay, we are here as I'm speaking, we are from the National Department of Health. We look after all the provinces and plus the city authorities. The delegations are done from this department up to the municipal authorities or city councils or city town authorities, and then we support. How we support the establishment is mainly we do food handlers courses, supervisors, and the handlers, the supervisors, and plus the managers of the establishments. That is what we do to help them. Apart from that, from the national department's aspect is that we go out if like Australia, Fiji, or other countries are exporting to our country. It's a national function. The department officers, the food safety officers, go out to audit those facilities or factories out there in the other countries.
Sure thing. So just a bit of an aside, are food businesses generally registered across the areas?
Yes, that is right. Every food establishment in the country must be registered, must have license to operate.
Sure.
Whether they are distributors or they're importers or they're retailers, there are different levels where they must be registered and licensed.
Okay, and what inspires you to do this work, James?
Oh, this that's I mean from different levels. What inspires the food safety officers to carry out day-to-day work is the support they have from their organizations when they're in the national department, they're in the municipal governments, or they're in the local level or district levels down in the provinces. They're inspired maybe by if we have a good, the main one I think of is training. If we are training and we improve their knowledge year by year, that will really inspire the officers, and plus providing logistics, and plus also the cooperation from the facilities or from the business houses.
Sure thing. So I think a bit like environmental health officers in Australia, we certainly see ourselves as educators more than policemen. So
that's right.
that's a big part of the
sometimes here changes to become like policemen also, but these days we try
when
to.
you have to, you have to. Yeah.
Yes. Maybe different places have different ways, but I believe we are more educators than policemen.
That's right. Yeah. And James, what kinds of retail facilities do you inspect, and are there any that are unique to your community or PNG generally?
Here in PNG, mainly the restaurants, maybe the hotels, the restaurants, the supermarkets, and there are two types that we like. They are more popular here. Taka shops, and kaibas. Taka shops are like small trade stores that they sell whether cooked food or tin food or packet food, but in a small setting. But they pop up everywhere in the city, around the city, maybe along the highways, in the villages also. And we all have kaibas. Kaibas are like takeaway shops. You go and buy some fish flour or sausage flour or whatever, all this, maybe some stew. They just prepare them in small areas, and then I think these are the two main like unique like food outlets we have in Papua New Guinea.
Sure. Okay. And do you coordinate with other organisations or associations to ensure food safety in PNG?
Yes, we do. Food inspectors here, mainly from our city and town authorities, carry out the food inspections in cities and the towns, apart from us here in the national department. And we also have food inspectors on every other districts, local government areas, right down to the rural areas. And there is one that, apart from the Department of Health, the food inspectors or environmental health, we have this ICCC, the people who more speak on the consumers' affairs.
Right. And from what you've said, I'm guessing with some of the problems that you have a fair degree of enteric disease from time to time and outbreaks. So how do you handle those? How do you handle outbreaks in PNG?
In PNG, it's like in the national department, in the information system, it's not captured. Foodborne illnesses are not captured as foodborne illness, so it might make us have that easy way of finding out any outbreak. So mostly it's the consumers that come. It's consumers, they have disease, they've maybe tummy ache, or maybe they're vomiting. They are the ones who report. So it's more on complaints that are lodged. So if a complaint is lodged, our inspectors go out. They go out, and mainly we normally close the shops, and then the inspectors carry out the investigations to find out the cause or establish the cause of the outbreak, or it may be a foodborne disease. And we work closely with the industry or the shop or the supermarket, or it may be the kaiba, to rectify the problem. If and when the problem is rectified, then shops are given a go to open up again.
Okay, and do you do where you get a number of reported cases? Do you follow through with like enteric sampling and that sort of thing, fecal samples and that sort of thing?
Yes, simply like comes out where we say that establish the course. Those are when samples are done. We have our Central Public Health Lab here, apart from the other laboratory, maybe privately run. And yes, the samples are taken to them to find out if it's
Yeah,
salmonella or yes.
yeah. It certainly sounds challenging, that's for sure. So that
Yes,
was
yes.
that was really all of my questions. Was there anything else you wanted to tell us about, James, in terms of what you do with the food safety side of things in PNG?
Oh, yes. The only thing you can say is it's quite challenging. Maybe we our training also is some of us are trained.
Oh, sorry, you've just frozen a bit there. I don't know if you can hear me.
Oh, sorry. Yes, so maybe our officers here have trained some years ago. I think it's a very challenging area to update the knowledge of food.
Mm. Yeah, sorry, your sound's just dropping out a bit there, James. I don't know if you can hear me.
And down to the town council, to the local level governments, and so on, down to the world. We have different levels of government here too. So.
Okay. And I've had a question pop up from Daniel Giffney. How has COVID affected your regulatory inspection programs?
Oh yes, COVID has really hampered our progress in many, like we can't do any gatherings, but in PNG the thing is looking okay here. So we can be able to like last week we were able to the, launch their food safety day. We launched our food safety day last week. We were able to be allowed because of the cases here are not that much like any other countries.
So you had significant lockdowns, James? Had there been
Yes, we
periods
did.
when you're under lockdown?
Yes, that's right. Last year and this year, but now the lockdown has ceased, and now it's new normal. People are encouraged to wear mask if you are going to the supermarket. Maybe if you are doing inspection, that's one thing they will not allow you to touch their food and all that stuff. You need to wear gloves. Yes, yes, because of COVID-19.
Okay, interesting. I don't think we've got any more questions there at this stage. No further questions. So thank you, James.
Okay,
And thanks for
thank
joining
you.
us today. It's been a
Thank
pleasure speaking with you and hearing what food safety regulation is like in PNG. And this has been an interesting exercise today. We're jumping all over the world. There'll be sessions tonight with NIHA starting a bit after midnight Australian time. So thanks again, James. Thanks for your time and much appreciated. And for everyone out there that's watching and listening, don't forget to join us in 2 hours and we'll be speaking to Lydia Bookman about food safety regulation here in Australia and in New Zealand. Lydia's a great deal of involvement with ANSFA, Australia New Zealand Food Association, Food Authority. So thanks again, James. Much appreciated.
Yes, thank you so much. Thank you for the opportunity to share with the rest of the world here.
Yeah, I see your vaccine rollout's going fairly well, so stay safe.
Thank you. Thank you very much. Yes.
Okay, bye now.
All right. Okay.